At Wellness 60 to 100, we're uncovering a common senior habit that might seem harmless but could actually be a hidden stroke in progress. You might think it's just a minor issue, but certain habits in older adults can signal serious health risks. In this video, we'll explain how this seemingly innocent habit can be an early warning sign of a stroke. Early detection is key to healthy aging, so stay tuned to learn how to spot this danger before it's too late. I'm Dr. Emily Carter, with 15 years of experience in geriatrics. A common habit in seniors, often overlooked, could actually be a sign of a stroke in progress. In this video, I'll help you understand how these subtle signs can often go unnoticed, and why early intervention is critical for healthy aging and preventing further damage. In today's video, we're focusing on a common habit among seniors that many might dismiss as part of normal aging, but it could actually be a sign of a stroke in progress. Dr. Emily Carter, with 15 years of experience in geriatrics, will explain how something as simple as a slight imbalance or sudden difficulty with coordination can indicate a deeper issue. Recognizing these signs early is crucial for healthy aging and preventing long-term damage. Stay tuned to learn how identifying these subtle changes early can make all the difference in protecting your brain health and ensuring a better quality of life. As we age, it's natural for certain physical abilities to change, but sometimes these changes can indicate something more serious, like a stroke in progress. One common and often overlooked sign in seniors is a sudden, unexplained imbalance or difficulty with coordination. You might notice that a loved one begins to walk more slowly, has trouble balancing, or appears unsteady while standing or moving. While these symptoms can seem like normal aging, they could be an early warning sign of a stroke, especially if they occur suddenly and without explanation. A stroke happens when there's a disruption in the blood flow to the brain, leading to potential brain damage. The symptoms of a stroke vary depending on the part of the brain affected, but they often include sudden numbness or weakness on one side of the body, trouble speaking or understanding speech, and difficulty walking or maintaining balance. However, in some cases, these symptoms can be more subtle and mistaken for signs of aging or other health issues. For instance, a senior may develop trouble with balance or coordination that they brush off as simply getting older, but these issues could indicate a stroke in progress. Recognizing these subtle signs is key to taking action before the stroke progresses. In the context of healthy aging, it's important for caregivers and family members to monitor for sudden changes in behavior, such as an unsteady gait, difficulty walking, or a noticeable drop in physical abilities. These signs shouldn't be dismissed, as early detection and quick intervention are critical to minimizing the long-term impact of a stroke. The sooner a stroke is detected, the sooner medical treatment can be administered, reducing the risk of permanent damage. In some cases, timely medical intervention can help reverse or minimize the effects of a stroke, improving recovery outcomes. It's crucial for both seniors and their families to be aware of these early warning signs and seek immediate medical attention if they notice any of these symptoms. One of the key signs of a stroke that is often overlooked is sudden weakness or numbness, particularly on one side of the body. For seniors, this could manifest as difficulty lifting an arm, feeling numb in a leg, or experiencing weakness in the face, such as drooping on one side. This sudden loss of strength or sensation is often a signal that a stroke may be occurring or is in progress. In some cases, it can be so mild that it's dismissed as part of aging or a temporary issue, but it should never be ignored. When a stroke occurs, it affects the brain by cutting off the blood flow to specific areas that control movement and sensation. The lack of blood flow can result in nerve cells dying, leading to weakness or numbness in the areas of the body that those brain regions control. While this can sometimes appear as a natural part of aging, it's important to recognize that this sudden onset of weakness, particularly on one side of the body, is not typical and could indicate an impending stroke. For example, a senior who suddenly struggles to lift one arm or experiences one side of their face drooping might not think much of it. However, these signs often signal that the brain is experiencing a disruption in its ability to send signals to the muscles. This is a dangerous signal that requires immediate medical attention to prevent further damage. Recognizing sudden weakness or numbness early can help prevent the stroke from progressing. In the context of healthy aging, it's crucial to address these signs as soon as they occur. The earlier medical intervention is sought, the better the chances of minimizing the damage caused by the stroke. Timely treatment, such as clot-busting drugs or surgical intervention, can significantly improve recovery outcomes, preventing long-term physical or cognitive impairment. Family members and caregivers should be especially vigilant for these signs. Early detection of weakness or numbness could be the difference between recovery and permanent damage, so it's important to seek immediate medical attention if you observe any signs of a stroke. One of the most concerning signs of a stroke in progress is sudden difficulty speaking or understanding speech. This symptom, which can appear unexpectedly, is often one of the first indicators that something is wrong. For seniors, it may start with slurred speech, difficulty finding the right words, or struggling to form complete sentences. They may also have trouble understanding others, even if the conversation seems clear to everyone else. In the context of healthy aging, recognizing these symptoms early can be crucial in getting immediate medical help, which could significantly reduce the impact of the stroke. When a stroke occurs, the area of the brain responsible for language and speech can be affected, particularly in the left hemisphere. This part of the brain controls the muscles used for speech and helps us understand language. A stroke in this region can impair the ability to speak clearly, recall words, or understand what others are saying. Even mild speech difficulties should raise concern, as they may be signs that the brain's ability to process language is being affected. It is common for seniors to dismiss these changes as part of aging, especially if they have experienced occasional lapses in communication before. However, if a loved one suddenly struggles to express themselves, repeats the same words or phrases, or has difficulty following a conversation, it's important to act quickly. These changes may seem minor, but they can be a sign of an underlying stroke that requires immediate medical attention. Recognizing difficulties with speech early allows for quicker intervention, which can minimize brain damage and improve recovery outcomes. If you notice that a loved one is having trouble speaking or understanding language, don't wait. Seek emergency medical attention right away. The faster treatment is administered, the better the chances of recovery and minimizing the long-term effects of the stroke. Speech therapy, in combination with medical treatment, can also help individuals regain their speech and communication abilities after a stroke. However, the key to effective treatment is early detection. By staying vigilant and paying attention to subtle changes in speech, you can help prevent a stroke from having a lasting impact on your loved one's health and quality of life. Another common and critical sign of a stroke is sudden changes in vision, which can often go unnoticed or be misinterpreted as a minor issue, especially in seniors. These vision changes may include blurriness, double vision, or even the sudden loss of vision in one or both eyes. When these symptoms occur alongside other warning signs like difficulty speaking, weakness, or dizziness, it's essential to seek medical attention immediately. In the context of healthy aging, understanding and recognizing the importance of these visual changes can help ensure early detection and treatment, preventing more serious consequences. The brain processes visual information, and a stroke that affects the areas responsible for vision can lead to significant issues. For example, a stroke in the occipital lobe, the part of the brain responsible for processing visual information, can cause partial or total blindness. On the other hand, a stroke that impacts the blood vessels leading to the eyes can cause blurry vision or even vision loss in one eye. These changes in vision are often sudden and may not be linked to any other health problems, making them harder to recognize as symptoms of a stroke. Sudden vision changes should never be dismissed, especially if they occur alongside other symptoms such as weakness, confusion, or difficulty speaking. Seniors, in particular, may be more prone to attributing visual changes to normal aging, but this can delay crucial medical intervention. Early recognition of these symptoms is key to preventing long-term damage. If a loved one experiences sudden vision issues, it's important to take immediate action by seeking medical help to reduce the risk of a more severe stroke. By staying vigilant for vision changes and recognizing them as potential signs of a stroke, you can help protect your loved one from more serious complications. Timely medical intervention can reduce the impact of the stroke on the brain, preserving vision and cognitive function. In the case of healthy aging, maintaining awareness of these early warning signs can make a significant difference in outcomes. Another common yet often overlooked sign of a stroke is a sudden, severe headache, or dizziness. While occasional headaches and dizziness are common in older adults, a sudden, intense headache that comes on without warning can be a serious red flag. For seniors, it is especially important to distinguish between ordinary discomfort and symptoms that may indicate a stroke in progress. In the context of healthy aging, recognizing these signs early is crucial for timely intervention. A sudden, severe headache, especially if it's the worst headache the person has ever had, can signal a stroke. The headache could be caused by a ruptured blood vessel or a clot in the brain, leading to increased pressure in the skull. Along with the headache, dizziness or a sudden loss of balance can occur, making it difficult for the individual to stand, walk, or move without support. These symptoms should never be ignored, as they can quickly escalate and result in permanent brain damage or disability if not addressed immediately. Dizziness can also occur when a stroke affects the cerebellum, the part of the brain responsible for coordination and balance. This type of dizziness is not the same as feeling lightheaded or faint. It's often described as a sense of spinning or loss of coordination. If a senior experiences dizziness along with any other symptoms such as speech difficulty, numbness, or vision changes, it's important to seek medical attention right away. In some cases, these symptoms may be mistaken for other conditions such as a migraine or vertigo, but they can be signs of a stroke in progress. The key is to act quickly, as early treatment can prevent further damage to the brain and improve recovery outcomes. The faster the stroke is identified and treated, the better the chances of minimizing lasting effects. Family members and caregivers should be aware of these warning signs and encourage their loved ones to seek help immediately if they experience a sudden headache or dizziness. Early intervention can help preserve cognitive and physical function, ensuring that seniors can continue to enjoy a higher quality of life. When a stroke is suspected, immediate action is critical. The faster the response, the better the chances are of reducing the severity of the stroke and preventing long-term damage. In the case of healthy aging, recognizing the signs of a stroke as early as possible and acting swiftly can make a significant difference in outcomes. Even though stroke symptoms might seem minor or fleeting at first, they can quickly escalate and cause irreversible brain damage if not treated quickly. The most important thing to do when stroke symptoms are observed is to call emergency services immediately. Time is crucial when it comes to stroke treatment. Every minute counts, and the faster medical professionals can intervene, the better the chances of minimizing brain damage. The faster a stroke patient receives treatment, the more options there are for reversing or slowing the damage caused by the stroke. For many seniors, recognizing the symptoms of a stroke may not always be straightforward. The symptoms can vary widely and may be subtle, especially in the early stages. For instance, a senior might experience slurred speech, drooping on one side of the face, or weakness in one arm. These signs could easily be dismissed as minor or attributed to other health problems, but they should never be ignored. Early identification is key to preventing further complications. Family members and caregivers must be vigilant in recognizing stroke symptoms and encourage the affected individual to seek immediate medical attention. If you notice any of the common signs, such as sudden weakness, difficulty speaking, sudden vision changes, or severe headache, get help right away. Delaying medical care can lead to worsened outcomes, including permanent disability or even death. Aside from medical treatment, supportive care is essential. Once the stroke is diagnosed and treated, rehabilitation plays a key role in recovery. Depending on the severity of the stroke, physical therapy, speech therapy, and cognitive therapy may be necessary to help the individual regain lost abilities and improve their quality of life. The goal is to promote healthy aging by supporting the person through rehabilitation, reducing the risk of future strokes, and enhancing overall recovery. If a stroke is not detected and treated early, the consequences can be severe and long-lasting. Delayed treatment can result in significant brain damage, leading to permanent disabilities such as paralysis, speech impairments, and loss of coordination. These effects can drastically reduce a senior's independence, making them reliant on caregivers for basic tasks. In some cases, a stroke can also lead to cognitive decline, depression, and emotional distress. Early detection and prompt medical intervention are essential for minimizing these effects, improving recovery, and ensuring that the individual can continue to enjoy a better quality of life and healthy aging. I'm Dr. Emily Carter, and I cannot stress enough how important it is to act quickly when you suspect a stroke. If you notice any sudden changes in your loved one's ability to speak, move, or maintain balance, don't wait. Seek medical attention immediately. Early intervention can significantly reduce brain damage and improve recovery chances. Encourage your loved one to get regular health checkups, especially if they have risk factors such as high blood pressure, diabetes, or a family history of strokes. In addition to emergency treatment, rehabilitation through physical therapy, speech therapy, and cognitive therapy is crucial for recovery. To support healthy aging, ensure they stay active, eat a balanced diet, and manage stress. Stroke prevention is possible, and timely care makes all the difference in preserving brain function and quality of life. If you found this video helpful, don't forget to like, share, and leave a comment below. Subscribe to Wellness 60 to 100 for more insights into healthy aging and stroke prevention. Share this important information with others, and hit the bell icon to stay updated on new videos. Together, let's help everyone age healthily and stay informed.